everybody. It is Monday, April the 6th. I am Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners, joined by my fellow commissioners, Commissioner Ken Lawrence and Commissioner Joe Gale, Dr. Brandon Weiss, Administrator for our Office of Public Health, and Dr. Al Long, Regional EMS Director, and Sarah. So since our press release yesterday, we have 145 new positive cases of COVID-19 in Montgomery County, which brings us to a total of 1,134. These positive individuals are from 43 municipalities, 2 of which are reporting their first cases. East Greenville Borough has 1 case, and Green Lane Borough has 1 case. This moves us to 59 of our 62 municipalities that are home to individuals with COVID-19. These individuals range in age from 9 to 110 years old. And as always, you can check our county map for the municipalities and the updated numbers by municipality. The age brackets today, we have 1 individual in the 0 to 9, 2 in 10 to 19, 18 in 20 to 29, 24 in 30 to 39, 35 in 40 to 49 years of age, 31, 50 to 59, 20 individuals, 60 to 69, 9 individuals, 70 to 79, 4 individuals, 80 to 89, and 1 individual, 110 to 119. We have 65 females and 72 males and 8 that are unknown. We have 3 that are hospitalized, 3 that are not hospitalized at home, and 139 that we do not have information on. Given the difficulty in tracking down individuals in terms of who is hospitalized and who is not, I will share this data with you that we believe that we have approximately 250 individuals that are currently hospitalized with a diagnosis of COVID-19 here in a Montgomery County hospital, of which approximately 70 patients require a ventilator for their care. Our most recent data is that every hospital in Montgomery County does still have vacant beds or open beds. I'm also saddened to confirm that 5 more Montgomery County residents have lost their lives to COVID-19, which brings us to a total of 27 lives lost. Today we have an 80-year-old male from Lower Moreland Township, a 78-year-old male from Lower Moreland Township, a 61-year-old female from Lower Moreland Township. We are unaware of any relationship between those 3 individuals. An 84-year-old male from Lower Marion Township, and an 87-year-old female from Lower Marion Township. Again, no relationship that we're aware of between those 2 individuals. 4 of these individuals passed away while in a hospital, all of whom had underlying medical conditions. 1 individual passed away at home, and I have no additional information about that individual. I just wanted to review an ongoing issue, which is why our numbers are different than the numbers that the state puts out every day. I don't have a full answer for you, but I do have a partial answer. So one of the problems, which we've mentioned before, is that our cutoff time for reporting cases is now at 10 a.m., whereas the state cuts off at noon. So any cases that come in between 10 and noon will be part of a discrepancy on any given day. We also note that there continues to be duplicate entries in the data that we pull down from the state. So if we want to compare today to yesterday, there's a difference of 122 people between what the state reported yesterday and what we reported yesterday. So if we looked at just yesterday, 25 cases were reported between 10 and noon. So there's 25 of the discrepancy. And we have accounted for approximately 66 cases that were either duplicates in the data that we pulled down from the state database, or were residents that actually lived in another county where we confirmed their address. There could be a few more than that, but we think it's about 66 cases. So in total, that leaves us with a discrepancy of 31 cases that I can't account for, and that is that the state is reporting 31 more cases than we are, and we cannot account for that discrepancy. We're still trying to figure out where that might come from, but I don't have any information on why that is today. I also want to remind everyone that we do not report on people in recovery because we literally have no way to obtain that information. You may have seen yesterday some very good news. An individual from Montgomery County, one of the first cases in this county, actually spent 17 days on a ventilator, has now recovered and been discharged home. I believe that this individual is back at home. So that just gives you some sense of the time period that can go by from when a person is first diagnosed, goes into the hospital for treatment, and then ultimately comes home. And at this point in time, we just don't have the capacity to track our over 1,000 cases. We have to literally be calling people every couple of days to try to figure out how they were doing. So just want to reinforce it. We don't report on recovery numbers because we just don't have the ability to get that number. A couple announcements about our community-based testing site. Site is up and running successfully. Thanks again to Temple Ambler and the Temple University Police, Upper Dublin Township, our Pennsylvania National Guard. We did have a switch out over the weekend, and we want to thank those Guard members that had been here and welcome and thank the new Guard members that are here today. And of course, numerous county departments that are assisting with this vital work. As of April the 5th, we have tested 3,940 individuals at our community-based testing site. We have received 57% of the results back. Remember that people are using this site from around our region, so we will never get 100% of the results back. We just get back the results from people who live in Montgomery County. We are now running 21% positive with those results. So to take you back a few days, for the first couple of weeks of this outbreak, we were running somewhere between 13 and 15% positive of the results that came back. 13 to 15% of those were positive. Late last week, Thursday, Friday, we were at about 17%. I think Saturday we were at 18%, and today we were at 21%. So again, we've been talking about that we felt that the beginning of the surge was coming, that we are anticipating that we will peak sometime maybe next week. We're not entirely sure of when exactly, but the fact that we're seeing more positive cases is consistent with what we've been expecting and what we have been planning for. We continue to be challenged by cancellations at the site. We do schedule more people than we have slots for because we anticipate that some people will cancel, but some days we've had so many people cancel that we could have actually taken more people. So please, when you schedule an appointment for the day, do your best to make sure. I mean, we all understand that things come up, but please do your best to make that appointment, because if you're not able to come, it means that somebody else could have been tested that day that we aren't going to be able to get to. So I would urge you to try to be as sure as you can that you can make that appointment. And this will become all the more important this week because we do believe that we have enough supplies to get us through this Friday, April the 10th. But after Friday, April the 10th, the site will close. I remind you that this was a site that was stood up with help from the Federal Health and Human Services Department, the Pennsylvania Department of Health, as well as all of our local partners that we've thanked every day since it's been open. But the federal site is shutting down here. It's also shutting down the site in Philadelphia, and that's all the information that I have about that. So we are extremely grateful for the resources that we've received at this site during this time. And after Friday the 10th, at least at this point, we will not have the ability to continue on with that site. For tomorrow, registration will open at 8 a.m. Either online at moncopa.org/COVID-19, or if you don't have good internet access or an email address, you can call 610-631-3000. And again, that will be for tomorrow. Slots for tomorrow will become available tomorrow morning at 8. I do want to point out, if you try to log on early, like 7:15 to the website, you're just going to get a message that says the website is closed. So it won't actually open for tomorrow until 8 o'clock. On Friday, I announced that our CEPA Smart asset will be coming to Montgomery County. It is effectively a mobile hospital that will be created for surge capacity here in the county. The final deployment plan is still being worked on, so I cannot announce a location yet, but hopefully by tomorrow I will be able to announce that, maybe the next day at the latest. But it's on its way, and we will be grateful to have it here in the county. This is a regional asset and will be shared by all 5 counties as the need arises, but it will be physically located here in the county. Couple words about social distancing. I was sent some photos over the weekend that were deeply concerning to me. One of them was from a grocery store that I know was trying to do the right thing by offering hours for seniors to shop. However, I think this has backfired in some ways, at least at some locations, because so many seniors, with the nicer weather coming, that people are anxious to get out in their gardens, and I am one of those people. I am right there with you. However, some of the places, the few places that are still open that sell plants and seeds and gardening supplies were apparently pretty mobbed this weekend. And again, people were not practicing social distancing. I cannot implore upon you how important this is. And if you pull up to a store and you see that it is mobbed, wait in your car or maybe come back an hour or two later. Please don't go in and make an already difficult situation worse. If there's too many people in there for people to be kept 6 feet apart, please do not go in, because we are just heading into the peak of this pandemic here in our area, and the most important thing that you can do to keep that curve flat is to stay home. We actually feel like we're doing okay right now, that we are okay in terms of the number of hospital beds versus the number of people, particularly with this additional surge capacity. But if you go out there, you could help make it be just one person too many. So please, if you see that, come back later. And that brings me to cloth masks. I want to give you some tips for the safe use of cloth masks. A cloth mask offers very modest protection. So do not think that wearing a cloth mask makes it safe for you to go into a crowded grocery store or a crowded home supply store, or to make any additional trips outside of your home other than those that are absolutely necessary. It doesn't. It gives you very modest protection. When you are wearing a cloth mask, when you return home or you get back in your car, you must handle the mask as if it is contaminated. That's the whole point, that it's hopefully protecting you from maybe someone that coughed or sneezed. So that means that you should take the mask off from the back. Don't grab it from the front, because you could be contaminating your hands. As you take it off, put it in a bag, and then immediately wash your hands with soap and water if you can, or with hand sanitizer, immediately after removing that mask. Do not take that mask off and set it on your kitchen counter or the table where you eat, or anything like that. It should go into a bag that protects you and the rest of your family from the mask. And then Wash it in soap and warm or hot water and allow it to fully dry before you use it again. If you just take it out of the bag the next day or a few hours later and put it back on and go out again, you could be contaminating yourself, all right? These masks offer modest protection. They are not magical. I'm gonna say it again for all those parents out there. Your kids cannot wear these masks and go out and play basketball with their friends. Your kids cannot put these masks on and go hang out with their friends unless they're 6 feet apart. Modest protection. All right, enough on the cloth masks. Hopefully everyone has that message. Now, an update from our Montgomery County Correctional Facility. As you know, this has been a high priority for us in the safety and the security there. Since the President Judge Del Ricci issued the initial March 12, 2020 order declaring a judicial emergency, the population in the Montgomery County Correctional Facility has gone from 1,342 to 1,122 as of today. This is a decrease of 220 individuals. Since March 12th, there have been a total of 392 discharges. The average number of daily people entering is now about 5 per day, compared to, on average, 28 per day before March 12th. And I want to reiterate that no inmates at the Montgomery County Correctional Facility have tested positive for COVID-19. And finally, I just want to continue to thank everybody in this community who's doing it right, the people that are staying at home, at limiting their trips to the most essential trips, and doing everything they can to keep their kids and everybody else in their family doing the same. Remember that what you are doing is you are protecting our hospital workers. You are protecting our police and paramedics and EMTs and other first responders. You are protecting the people in front of me that you can't see, that are our telecommunicators that are answering your 911 phone calls, and everybody else that's here in our emergency operations center. You're protecting those people that are checking you out at the grocery store and at the pharmacy, and all the people that help supply those places. This is the most critical work that you can do, particularly as we head into what we think is going to be our surge over these next 10 days or so. Right now, we've done a great job as a county. This community has been amazing. I've showed it to you from that anonymous cell phone data that companies track. We're doing a good job here in Montgomery County, and so far our hospitals are okay. But this is crunch time. This is no time to let up. This is the time to continue to do what you've been doing, and just be smart. Just use your common sense. If you pull up to a grocery store and you see that the parking lot is packed, just pull back out and come back in an hour or two. It'll probably look a lot different. If you just see that something looks crowded, go home and come back later. Don't even get out of your car. Why take the chance? So thank you to everybody who's doing it right. And for the people that are doing it wrong, I know you know who you are, and you need to stay home. And with that, I'll turn it over to Commissioner Lawrence.
Good afternoon. Today I'd like to announce the Makos Strong Small Business Grant Program. We recognize the need to support our small businesses during the COVID-19 outbreak, particularly those businesses who have been closed and deemed non-life sustaining. So through this program, we'll support businesses with financial assistance during grants. The county is dedicating $1 million in economic development fund grants through bonds proceeds for this program. Eligible small businesses in Makos can apply for up to $25,000 to help with making rent or mortgage payments, meeting payroll expenses, and covering utility bills. Eligible businesses can have no more than 50 employees, and priority consideration for funding will be given to businesses that are certifying that they are continuing to employ their employees during the closure. Links to the Makos Stronger Small Business Grant Program can be found on our Commerce Department's homepage at www.montgomery.org/commerce, as well as the Montgomery County COVID-19 Data Hub at www.montgomery.org/COVID-19. It includes information about the program guidelines and application instructions. Applications will not be accepted until 11 a.m. on Wednesday, April 8th, and they'll be reviewed on a rolling basis until all grant funds are awarded. We will also have a dedicated email account, montcostrong@montcopa.org, beginning on Wednesday morning to assist applicants with any questions before they submit an application. And we appreciate the collaboration and partnership of our Redevelopment Authority, led by Jonathan Spurgel, the chair, and Jerry Nugent, executive director, who along with the entire Redevelopment Authority Board of Directors and their solicitor have worked closely with the commissioners, our senior county leadership, and our Director of Commerce on this initiative. We've also spoke about our homeless population since the beginning of this epidemic, and I want to give an update on that. Since March 30th, our agency, Your Way Home, has been working hard to make sure that our homeless populations are being kept safe and are able to participate in social distancing practices. Your Way Home has been able to relocate 36 individuals and 8 families, 30% of the population, from 4 of our largest shelters into hotels. And there have been no positive tests in any of our shelters. Prior to this action, shelters could not comply with the order to stay 6 feet apart. Decongesting homeless shelters provides extra safety and protection, particularly for those who are very vulnerable to the virus, the elderly, and people with chronic health conditions. Households in the hotels are provided daily meals and regular case management by their emergency shelter caseworkers and street outreach providers. We are still in need of funds for hotels and other emergency needs for people experiencing homelessness during the COVID-19 pandemic. Please consider making a donation at www.yourwayhome.org/donate. And we want to thank everyone who has supported this fund and all of our local hotel partners as well. And with that, I'll turn it over to Commissioner Joe Gale.
Hello, I'm Joe Gale. I hope everyone watching had a safe and happy weekend, considering the less than ideal circumstances we're all facing. I have received several questions about expiring driver licenses, vehicle registrations, and safety inspections. In response to COVID-19, PennDOT has implemented a variety of operational changes. All driver's license centers and photo license centers in Pennsylvania have been closed until further notice. Driver's licenses, photo ID cards, and learner's permits scheduled to expire March 16th through April 30th have been extended until May 31st, 2020. The May 31st extension applies to CDLs, commercial driver's license, as well. For vehicle registrations and safety and emissions inspections scheduled to expire March 16th through April 30th, the expiration date is also extended until May 31st, 2020. I would also like to remind you that the Department of Homeland Security is extending the Real ID enforcement deadline beyond the original October 1st, 2020 deadline. I also received many questions about this as well. States have been given a 12-month delay so that the new deadline for the Real ID enforcement is now October 1st, 2020. So we will continue to keep you updated as more dates come available. And I'll turn it back to Commissioner Arbush.
Thank you. So just one more reminder. I know that very important religious holidays are coming up this weekend, and unfortunately it is critically important that people do not gather together in physical locations to celebrate Passover or Easter. All the good work that has been done over this last month could be very quickly undone by people coming together in large groups that are unable to practice social distancing. So I know that this is so difficult for so many people, and this is certainly a time when those that practice faith, or any faith, want that practice is more important than ever to provide strength and solace during this very, very difficult time. But unfortunately, we cannot promote people coming together to celebrate these holidays. Many in our faith community are doing some really creative things with online and Zoom and other modalities of coming together virtually, and that is wonderful. But we want to encourage people not to come together in a physical space unless it's a very small number, less than 10, and they can be socially distant. So with that, I will take questions.
Can you, expand or explain a letter from Southeastern PA executives that went to the governor talking about load balancing? And what's the focus, what's the goal of that, and what does that help do?
So the question is about a letter that was signed by the four county commission chairs and Mayor Kenny here in the 5 county southeastern Pennsylvania region, asking the governor to consider implementing what's called load balancing for our hospitals and for our ventilators. And what that refers to is a process that would be centralized out of the Pennsylvania Department of Health that would look at all of the hospitals in our state and see where there were beds that were open, where there were intensive care unit beds available, where there were ventilators available, and in the scenario in which we were at capacity or over capacity here in the Southeast, that there would be willingness from other hospitals to take a small number of patients from different areas here in the Southeast to help balance the load, so that we can make sure that we don't run out of beds across our state. Most of the modeling suggests that we do have enough beds across our state to weather this pandemic. However, that doesn't mean that the right number of beds are in the exact same location as the cases. And so by implementing a policy like this, which some other states have done pretty successfully, it would maximize the chances of making sure that everybody in Pennsylvania who needs a bed or needs a ventilator has one. So that letter just went in today and we're awaiting a response.
So fair to say that you expect or models show that, for example, a surge here in southeastern PA, maybe Pittsburgh, and then that spreads across the state, and the equipment could kind of go with. Is that kind of what the goal is, or is that?
So the question is about the goal of the letter. The goal of the letter is a very simple one. It's to make sure that every Pennsylvanian who needs a bed has a bed, and every Pennsylvanian who needs a ventilator has a ventilator over these next, several weeks.
Well, that's not really what I asked. What I'm saying is the expectation then that, say, southeastern PA has more cases than central PA, or you're able to move resources to different locations as it goes?
So the question is the expectation that the Southeast, for instance, will have more cases than other parts of the state? That's currently the case today. Hard to tell what the future is going to bring, but we would assume, at least for the next couple of weeks, looking at the numbers, that the Southeast will have many more cases than a lot of other places. And if we do exceed capacity here, that maybe there are hospitals that aren't too far away that would be able to take a few patients here, a few patients there, but that could be enough to make all the difference.
And then get over the hump and reverse it, I guess, as well.
Yeah, I see what you're saying. So your point being that then if later on down the road, if a different part of the state had a surge, that we could take those individuals here potentially?
Right.
Yes, if that's how it played out, sure.
Commissioner, the talk this week has been about how it's supposed to be the worst, expected the worst nationally. What does that look like for Montgomery County and the residents here as far as trying to weather the storm of this week?
Well, we're not sure that this is going to be the worst for us. The national models don't necessarily apply to us here. There is some modeling for Pennsylvania that suggests that the worst, and when I say the worst, I mean the peak need for resources is going to be around April 11th, April 12th, but again, that's statewide. So we're just assuming that we'll be somewhere in that range here. We have been working very hard here to keep that curve flat in Montgomery County, and so far all 9 of our hospitals do have open beds and open both regular beds and ICU beds, and we have ventilators that are still available. So our hope here is that we're going to get through this with enough beds and enough ventilators for the people that need them. We are creating surge capacity, which I alluded to earlier, to help ensure that that's the case. And then this letter asking for what's called load balancing for both beds and ventilators across the Commonwealth is just an added piece of safety to try to get us through there. So if people stay home, hopefully we'll get through this okay. Our hospitals might be quite full, but hopefully there'll be enough beds for everyone that needs one. And that's been our goal and our call for staying home and practicing social distancing from the very first week that we had cases. It was all leading up to this, to keep that curve flat, so when that peak comes, our peak is relatively low, and we have the resources, the first responders, the people answering 911 phone calls, all those people will still be able to do their jobs because they're healthy, and we'll have enough to get through this. But people have to stay home.
So it appears that the peak will be here after that community testing is done. Is there going to be any kind of an overlap, or is there a plan in places that the mobile hospital is supposed to be here to relieve, take the place of what's leaving?
So the testing site is just a discrete testing site. The mobile hospital will not be a testing site. The mobile hospital will be functioning as overflow for patients that need hospital beds. There are many places now that are doing testing. So although this has been a great help to our hospitals to have this testing site, we now, most of the hospitals, I think all the hospitals at this point now, can do testing either at their facility or they have an off-facility site where testing can be done. I think what's important about the testing site and why it's been so helpful for us is that it's a way for us to look at the trends here in the county, and we've been looking at the percent positive the results that we get back, what percentage of them are positive, and we've slowly seen that start to tick up in the last few days, which is consistent with the modeling. The thing that's difficult about the site is that we don't get the results back for anywhere from 3 to 5 days, sometimes 6 or 7. So it's always been a lagging number. So the fact that it's ending on Friday isn't that critical. It's given us an enormous amount of very helpful information. It's helped a lot of individuals now, almost 4,000, know if they were positive or not. So that's been fantastic. But we don't have control here at the county level over a federal asset, and we've been told that it's done as of Friday. So we will figure it out. We will make do.
You mentioned the 21% testing positive. As we head into the peak, what does that number look like? Is it going to go 25, 26, and then go down, or do you have an expectation?
I wish I knew. I wish I knew the answer to that. The hope is that it will stay relatively modest, that peak. To put in perspective, there's neighborhoods in New York City where I think 35% of the people that are tested are positive. I think I've heard anecdotally even higher in some places. So, hopefully we'll stay on the lower end of that. The most important thing is that we have enough beds for the people that need them. So it's a combination of not just that people are positive, but the people that are most likely to have severe forms of this disease have a bed if they need one. And if they call 911, that there's someone who could come and get them. And by the way, that there's a bed for the person having a heart attack or a stroke too, right? It's not just about COVID-19. It's about making sure that our hospital infrastructure can continue to support anyone that needs to be hospitalized, and same with our first responders. So the whole goal here is just keep everybody home. People keep doing that. We are, feeling like we're okay today, but people have to stay home. There's just no substitute for that.
Over the weekend, there was a Bucks County firefighter who passed away with COVID-19, and today we got confirmation about a Philadelphia police officer who passed away. So has there been any talk to first responder groups, emergency worker groups, public safety workers about trying to, stay safe or as safe as they can, but still do their job?
Yeah. Why don't I let Dr. Al Wong, who runs our regional EMS, address that question. We're in constant communication with them, but I'll let him take that.
So the question was about preparedness for first responders in terms of resources for their protection as well as continuity of their operations. And have been working with them for the weeks and even the months leading up to this to make sure that they are fully prepared. As an example, we have pushed out guidance on the appropriate personal protective equipment for them to wear. We have pushed out recommendations on how to extend, if necessary, the life of that equipment and strategies and resources on how to minimize the expenditure or the burn rate of that equipment. In addition, all of what we are asking the public to do is to stay home, to allow our first responders who can't stay home, or hospital workers who can't stay home, the ability to do their jobs, to work in the hospitals and the EMS agencies that they have to report to, and to allow them to take care of the public as safely as possible. So those are all things that we've been asking in support of our first responders. We understand this is a tremendous strain on the first responder community, so there are resources to help them as well. And we hope that they know that we are supporting them in every step of the way, and we think about them every single day as we all work together to get through this pandemic.
Thank you. A question about the financial aid.
Sure. And actually, before you do that, I just remembered, I forgot to mention one thing earlier, which is our trails. Our Montgomery County trails are getting a huge amount of use. However, there are numerous reports from our park rangers that people are not maintaining social distancing on our trails. So don't make us close our trails. We will close our trails if people don't start social distancing on them. I would hate to have to do that, but that message on social distancing applies to our Montgomery County trails as well. So please, 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 if you get out on the trail and you see it's jam-packed, get back in your car or on your bike and come back later. Don't put us in a position where we have to close our trails, but we will if we cannot maintain safe social distancing on our trails.
Are park rangers going around enforcing that as well?
They're trying, but there's a lot of people out there. And so the question was, are the park rangers going around enforcing? Our park rangers are out patrolling our trails as they always do. And they're doing their best to enforce, but there's been a lot of people out and a lot of people very close together. So we really need people to pay attention to that.
Before I let you go, the grocery store where you got the photos from, if this becomes more of a trend, could businesses like that face any kind of a penalty down the line?
Well, we have asked our Office of Public Health to reach out to some of the grocery stores and remind them of the importance of social distancing and other measures during this time. Look, they're trying to do a good thing, I think, that sounded good on paper by inviting seniors to shop at one time, because seniors are a more vulnerable community. We know that very clearly. They're much more likely to get a severe form of this disease. But I think it overshot a little bit. And so lots of seniors are showing up within an hour or two time period. And if they don't have the right, all their checkout lanes open and other things like that, we're finding people standing in line, etc. So really important that if you see the parking lots full when you pull up during senior hour, come back at 4 o'clock in the afternoon. The place will probably be empty and you'll get through a lot quicker. So, don't just go during senior hour if you pull up and the parking lot is full. Again, I think done with the best intentions, but it's got to be done properly. And did you have a question about
for
the business?
Commissioner Lawrence about
Yeah,
the federal loans or the loan
County grants.
county loan. So with businesses having the option of county loans now and federal loans, are you all working with people on the federal level to make sure or to help out businesses, or is this something that's totally isolated from the asking for a federal loan as well?
So ours is a grant program.
Okay.
It's not a loan program.
Excuse me, yeah.
And people can apply we're encouraging everyone to apply for as much as they can. There was a state program, but it ran out of funds. There is a federal program as well, but you're not prohibited from applying for our grant program if you apply for federal or state assistance.
Do you have a
It's in addition to that.
Do you have a ballpark figure of how many businesses have been impacted so far?
No, that's a lot.
Yeah.
A lot.
Anything else? Oh yeah, Todd,
Yes, we received several questions pre-submitted by reporters. The first one is from Carl Hessler at the Pottstown Mercury. To date, has Exelon notified the county regarding how many workers have tested positive for COVID-19 at the Limerick generating station? And if so, on what date were those infections confirmed?
We have been notified that there are positives as well as individuals that are in quarantine because of exposure to positives or because they have symptoms. I was told by Exelon earlier today that they were going to make that information public on the Limerick generating website, the station's website, sometime today. And if that information is not made public today, then I will make that information public tomorrow.
Another question from Carl Hessler. Has Exelon indicated if the positive cases were among the regular workforce or were they contractors?
They have, and hopefully they will release that information as well.
Another question from Mr. Hessler. In the daily reporting of positive cases in the county, have officials noticed an uptick in cases in Limerick Township? And if so, can these cases be traced to the generating station?
I don't know that we've really seen an uptick in Limerick per se, but that's not really the point. The contract workers are from all over the place. I still have not received a full list of where they're all from. They're staying all over the several county area, and again, I don't have a complete list of where they're all staying. And of course, they're interacting with the 700 plus individuals that are the full-time workforce at Limerick. So I think what we would expect to see is just a general increase in our numbers beyond what they would have been had this refueling been postponed.
Another question from Carl Hessler. Was contact tracing completed to determine how many other coworkers at the plant had direct contact with any of the infected workers? And if so, how many coworkers were told to quarantine and self-isolate for 14 days?
That's a question for Exelon. Exelon is doing their own contact tracing.
One more question from Mr. Hessler. Is there a concern that if many workers are positive or quarantined, that Exelon won't have the workforce available to complete the outage?
I asked about that question. I asked that question early on in my efforts to try to get them to postpone this. They told me they had contingency plans in place, but I don't know the details of any of those plans.
One final question. This is a request for clarification. Whether it's safe to have contact with others outside of your household if you are wearing a mask. And the example that was provided, is it safe for kids to play with the neighbor's kids if they have masks on?
No. That's all I have to just no. If they had, which they won't because they're kids, if they had fitted N95 masks like our hospital workers wear that have been fit tested and shown to not allow anything in, then maybe, but not with any masks that are available to the public right now. No.
Just a quick question that came up here. Did you give Exelon a deadline to give you the information? I remember you talking about it last week. You were supposed to get how many workers, where they were, so they didn't.
So our Office of Public Health is in daily, sometimes multiple times a day, communication with them, and they're getting information. I communicated with my main contact at Exelon this morning that there were a lot of questions here locally, and that I felt they should be, as I've said all along, they should have a press conference. They should answer your questions. That if they didn't start sharing with the public what these numbers are, that I would do so beginning tomorrow. Okay. Thank you, everybody. We'll see you tomorrow at 3.